Well, it has been 30 years since Texas had a case of malaria.
But that has changed this week with one reported in Cameron County in far south Texas. Deusen from the Texas Department of State Health Services joins us live now. Chris, good to see you. Thanks for being here. This is
good morning. The
first locally acquired case that we've had in decades, meaning somebody didn't get it from traveling outside or abroad. How big of a concern is that?
You know, it's a concern. It's something we want people to be aware of, and it's something that we want people to take action to prevent, and that advice really is the same thing we tell people every year to protect against all kinds of mosquito-borne diseases, and that is to keep from getting bitten by mosquitoes, something people want to do anyway. So, if you're going to be outside, especially for an extended period of time, especially overnight or dawn and dusk, wear insect repellent, long, loose-fitting clothing, long sleeves, long pants, and then as much as you can, it hasn't unfortunately been an issue lately, but if you got any standing water around your property, dump that out so mosquitoes don't have a place to breed. But what you said is right. We do see travel-related cases, in fact, more than 120 every year on average in Texas. And all it takes is the right mosquito, or maybe the wrong mosquito, biting the wrong person to spread that to somebody else. So we've just seen the one case right now, but this is something that's a risk every year because we do see those travel-related cases, people going and coming from areas where malaria is spread commonly.
Well, when we hear that malaria is nearby, you can't help but wonder, okay, what do those symptoms look like? And you can't help but be just a little paranoid when you see a mosquito nearby. What does that look like, and how serious of a health problem is malaria?
Yeah, so malaria starts out, with some pretty general kind of flu-like symptoms. I mean, it's fever, shaking chills, sweats, headache, body aches, nausea, those kinds of things. So it can make it hard early on to differentiate that. That's why if you have those symptoms, a doctor's going to test you for various things, and if they can't rule those out, especially if you've traveled to somewhere where there's been malaria transmission, that might be a key time for them to think about that. It is important to treat it because it's a very, very serious disease, and if it's not treated, it can progress into severe malaria where it starts to affect the brain and the nervous system. People can get disoriented, have seizures, you can have low blood cells and anemia, and can really lead to an impact, a very, very serious impact on breathing, and it can be fatal.
So this person worked outside, and that's how this person contracted it, again, in far south Texas, Cameron County. Is anything being done in that county or in other places across the state because of this?
Yeah, we've been working with local health departments, kind of in the impacted areas. They've been trapping mosquitoes, doing some spraying, and so far we have, been able with them to collect mosquitoes and test them. We've not identified any mosquitoes that have the malaria parasite, which is good news. So it doesn't sound like it's very widespread, but we're going to keep looking for that and doing that testing with our colleagues at CDC. One thing to note is it's only one particular genus of mosquitoes, so a few species that are capable of transmitting malaria, and they're different mosquitoes than those that transmit West Nile or dengue or some of the other mosquito-borne diseases. So it really does have to be a very specific type of mosquito, and they are fortunate they are present in Texas, but they are not the most common mosquitoes in Texas.
All right, Chris, thank you for all this valuable information. We better understand it. And again, nothing to be too alarmed about. Just keep your eye on the situation.
Yeah.
And wear that repellent. Thanks.
All right.